Global Chief Health Officer for IBM. It's a pleasure to talk to you today. Um, as you know, the theme of our conference this year is Invest in Health, which can mean so many things. And I'd love to know from your point of view, what does invest in health mean to you?
Jess, real pleasure to be talking to you today. I think this is such an interesting concept because we often think about healthcare as being a cost. We often think about it as something that we have to spend money on, and we don't talk very much about the return we get from that cost, which is at the very essence of investment. So I love this concept, and I might describe it in two main areas. The first is around return on investment, so financial investment. And we know there was a growing body of evidence, an international body of evidence coming out of things like the World Health Organization and the World Bank around the very close relationship between health and wealth. So we know that healthy populations are more productive in the workplace. We know it has a direct relationship with economic growth. There is obviously a relationship with fiscal return, while people who are healthy are more likely to be in the workplace. And then some really interesting stuff around education. So when children are have a high level of nutrition and they're healthier, we know they learn better. So there are important economic implications for a future generation. And of course, the one we always talk about is avoidable costs. So investing in prevention and intervening earlier and earlier in the kind of natural history of disease, we know reduces the burden of things like long-term conditions and non-communicable diseases. So there is a real cost element to the return on investment in healthcare. Most kind of academic bodies would put that between twice to 10 times. So for every dollar you invest in healthcare internationally, the evidence is you'll get $2 to $10 back again about how you measure it. But of course, we can't just measure return of healthcare spend in monetary terms, and this is very much around social capital as well. This is around happiness. It's around our societies. It's around equalities in our society, and those things. Just because they may be harder to measure doesn't mean they're any less important. The other area that I might just, Jess, if you don't mind, kind of just touch on is this concept of long-term investment. So when we think about spending money on healthcare, we often take quite a short-termist view, but actually increasingly we're learning that this is around a kind of taking a much more strategic, a much more long-term view around the natural life cycle of health systems. So a much stronger emphasis around prevention, big emphasis around things like screening, early detection, some really important concepts around investing in a right-sized workforce. We know we have a deficit in healthcare professionals, but we also have a deficit in the kind of skills that we would ask that workforce to deliver in a kind of new and reinvented healthcare delivery system. And lastly, a long-term investment in some of the technology that underpins that design conversation around reinventing how we might deliver healthcare in the future. So I might just describe it in those two boxes, one around kind of the return that we get, but also in terms of taking a more long-term view.
Thank you. That was really interesting. It's really important for us to bring together a diverse range of voices from across the globe to offer different perspectives. I know that you get invited to a lot of conferences. What is it about Global Health Expedition here in Saudi that stood out to you and inspired you to travel from across the world to take part in this event happening in October?
Yeah, I think one of the sort of real magic things that happens in kind of high quality events, like the Global Health Exhibition, is when you bring together disparate voices, as you've alluded to, and three of the most interesting voices are the voice around policy. So how we do large scale system reform, how we take the public and professionals with us on a journey, and how we co-design a version of healthcare for that's fit for the future, so-called kind of healthcare 3.0. The second community I think is unbelievably important is that of academia, and some of the kind of evaluation and academics that are active in this field. And lastly, industry suppliers, and although I speak from the point of view of a technology in partner specialized in digital transformation, there are of course other really important industries such as the kind of device and service design industries. So having those three voices together in the same place to contribute to this design conversation, in partnership with those who are charged with actually running the service, so those who are involved in either providers or payers, clinicians, managers, patients, and associated professionals, is an incredibly rich conversation, and it's one that personally for me, it's a great privilege to be a part of.
Thank you for that. And we are bringing a lot of different nationalities and specialities together. What do you see as the importance of global collaboration in shaping the future of healthcare?
Yeah, I mean, I'm a collaborative person by nature, and I believe fervently in the power of people coming together to solve difficult problems. And the reality is that no country has all the answers in this regard. No country has the perfect healthcare system. And it's unbelievably important, I think, for international groups to come together and share perspectives and learnings and best practice and kind of innovations with each other, and discuss and debate in a real sense. So not just talking about how great everything is, but actually talking about some of the challenges and how we move to a world where we kind of get into the detail around how you implement um, new systems, redesign delivery models, think innovations like AI, and measure the value in a way that really means something to patients, to carers, and professionals. So I think that co-design collaboration, if I can use that phrase, is a really important part of an event like this. And if I was to be blunt, I might say that healthcare is so challenged at the moment all around the world. For a whole raft of reasons, we have a significant discrepancy between demand and supply. And no country, I believe, is going to dig itself out of this particular hole on its own. And actually, the route to solving these problems and finding implementable, scalable, at pace solutions to these kind of really difficult problems involves international collaboration, international learning, and sharing. And that's one of the reasons that events like this are so important.
Absolutely. And you've highlighted how true well-being goes beyond the clinic with your work. So how it shaped the wider start again. You've highlighted how true well-being goes beyond the clinic, shaped by wider determinants of health. And at the same time, hospitals are being reimagined with digital front doors, like patient portals and apps, and with AI and automation reshaping care delivery. From your vantage point at IBM, how can technology help bridge this interface between society and healthcare? And what lessons can health leaders from across the world take from applying cross-industry techniques like flow optimization, augmented AI to redesign systems for equity, access, and sustainability?
Yeah, so we really, I mean, that's quite a big question, isn't
Quite a big
it?
question.
Quite a big question. There's a couple of things to unpack in there, and one is the shift that healthcare is making from a conversation that starts with provision, starts with a professional group or a particular type of provider, or a particular way of delivering healthcare, and starts to pivot so that it starts the conversation with a population and what it means to a population. And we have learned through kind of experiences in many parts of the world that if you take a hospital and you run it really effectively from a financial, operational, and clinical perspective, what you end up with is a very well-run hospital. You don't necessarily end up with a healthier population with better outcomes, better experience, and all the things that we care about, underpinned by the triple aim. So there's a real pivot to starting with the population and starting with the groups within that population and engaging in a design conversation that is not only around operational efficiency, but also around allocative efficiency, how we use the resources that we have in healthcare targeted against the needs in those cohorts, to really improve outcomes experience, and do that in an increasingly cost-effective way. I believe technology and artificial intelligence, particularly, have an enormous part to play in this. Not only around the kind of digitalization of a reinvented hospital, as you allude to in your question, but also about how we defragment our services and start to join together services based on a more patient-centered, cohort-centered model, and start to really kind of join together those care pathways in a much more holistic and, I would say, patient-centered way. So digitalizing, if you like, the space between providers. And then the third one is digitalizing the space between citizens and the service itself. And in many ways, that's perhaps the most powerful shift in all of this. As we start to move towards a more participative, a more personalized model of healthcare, where rather than patients being passive recipients of whatever services may be available in their geography, actually, you end up with a much more adult, much more partnered relationship, a much more self-serve in many ways experience of healthcare delivery. And in one of the lessons from particularly B2C industries, business to customers industries, has been the power of this kind of shift to a more self service model. And there's a whole range of technologies, AI and other kind of platforms, to enable and support that kind of empowered patient view of the future. Just to give you by way of an illustration about why this is so important, we know that when you look at outcomes, probably about kind of 10% of the outcomes that you can measure are attributable to medical care, the kinds of things that doctors and nurses do. The rest of the things that define what your outcomes relate to, as you mentioned, the kind of wider determinants. So housing and transport, and employment and social contacts and your environment, and those kind of things. So if we're really serious about this issue around improving outcomes and experience, and we're serious about shifting the curve of the demand of healthcare to the left and moving towards a more sustainable model, we need to apply the same kind of rigor and project discipline and digital transformation ambition to those wider determinants as we do to the delivery of healthcare itself. And I honestly believe that's one of the most exciting conversations in healthcare at the moment. And I think one of the things that is going to be most impactful, more impactful than a new drug, more impactful than a new app, more impactful than a new diagnostic device. In many ways, patients and citizens are the least used asset that we have in healthcare. And they are in many ways the kind of secret weapon for us to unleash when enabled with digital capability.
Thank you, Mark. I'd really love to end our conversation with you telling us a little bit about what people can expect from your session at Global Health Expedition this year.
Yeah, no, for sure. So I'm going to be involved in a couple of sessions, in fact, this year. One around the opportunities of learning around what the digital patient of the future might look like. So we're going to be talking in more detail around some of the technologies that make this personalized participative model of healthcare a reality, and talking about some of the evidence around how that's made a difference. The other session I'm going to be involved with is the relationship between large scale policy and clinical innovation, and how we, from a policy perspective, create an ecosystem and in an environment that is innovation positive and drives new ideas, new technologies, and new ways of implementing and thinking about driving value across a kind of larger scale, across a kind of national scale. So I'm really excited to have to be taking part in those two conversations with colleagues.
Thank you so much, Mark. We're very excited to be having you with us this year. Thank you for your time today.
Pleasure.